Hi everyone, I'm Dr. Mark LeMay. I'm a chiropractor for the last almost 30 years, and I'm also an applied clinical nutritionist. And today I want to share a little of the knowledge that I've gleaned over that last almost 30 years of treating people with back pain. Because there's some things that you can do on a daily basis that are going to save you a lot of pain. So again, this is something that if you do these things that I'm going to show you right now, this will greatly reduce your pain or maybe even eliminate it totally, because again, as much as I love seeing my patients, I know they don't want to see me all the time, and I'd like to save you some time and money and just come in for like regular tune-ups. So what I'm going to do here first is I'm going to show you how I assess, people's low back pain and the muscles in the low back. And at the same time, a lot of these things that I do as an assessment are also the fix for the problem. So the first thing I'm going to show you how to do is checking the low back muscles and even like the gluteal muscles here. So the first thing you're going to do here is you're going to do what's called a child pose, which is something they do in yoga. So you're going to be going on a bed or a table like I'm doing here today, and you're going to be basically going into this kind of position here. It's like what kids are like when they're sleeping. You see these kids, their legs apart, and they have their face down, they're turned one side like this, and they're just, relaxed. And that's what we're going to do here. So you're going to feel, is there tension in the low back area right here, and also in the gluteal area? Because for me, just doing this, just relax her for a sec, pretty much feel it on my left side. That's where I feel a little bit of tension in the area. So what you do is if you just do this for like 1 minute, that's all it takes to get the muscles to relax in that area. That pretty much relieves the tension and the discomfort in that area. This is something that I tell my patients to do when you first wake up in the morning. Roll over, get into this position right here, and stretch before you get out of bed. But here's one thing. Be careful that you don't fall asleep. Because if you fall asleep like this, you're going to wake up and your knees are going to be killing you. So that's number one. The next thing we're going to do is we're going to check out the gluteal muscles. To do that, just lay on your back, and you're going to bring your right knee and pull it towards your chest up here. Feel for the tension down here in the gluteal muscles. And then do the same thing on the left side. Pull your knee towards your chest and just see if you get any tension on the left side. I feel it mostly on my right side for this one here. So again, to fix this, pull your knee towards your chest where it's comfortable for like 1 minute until you feel the tension disappear. Okay, do that for 1 minute, and then make sure that you do the other side too, because we want to create balance between the right and left side of the body. So do your left side for 1 minute too. Now the next thing you want to do is we want to do an evaluation for your psoas muscle. This is a deep muscle that attaches to the lumbar spine in the front. It goes all the way into the pelvic area here, so that really affects your low back too. So if this is really tight, all you do is go to the side of the bed, drop your leg over, just let it hang down here, and just feel for the tension right through here. Okay, so do the right side, and then go over to the left side and drop it over the edge. Okay, and then basically just feel for the tension on this side. So for me, I feel more tension on this left side right here. So again, just keeping your leg down here like this for a minute till you feel the tension go away is really good. And then you'll see this a little bit better when I do it on this right side right here. If you just bring your leg down, and again, if you're feeling some tension right here, again, you can even add a little bit more tension by just bringing your foot back a little bit like this. It'll even add more tension to this area. So if you want to stretch it even a little bit more. So that's the ones you can do for the psoas muscle. Now the next muscle group we're going to do is quadratus lumborum. That is the muscles on the side here. That's the muscle that goes from your hip bone all the way to your ribs on both sides. To assess that, basically tip like this to your side and then go the opposite side just like this. Boy, I'm tighter on my right side. I can really feel it on this side. So again, just holding this for 1 minute will help to lengthen the quadratus lumborum muscle like this. Now you can do this standing too, but for purposes right here, I'm just going to do it with me sitting. And then, of course, do the opposite side just like this. Okay, so that's quadratus lumborum muscle. Now, the other major group that you want to check is the internal and external hip rotator muscles here. They're deep down below the gluteal muscles. They control internal and external hip rotation. That is a group of muscles that gets very tight on people, especially if you do a lot of driving. You're going to have that kind of a problem. So to assess that, you're just going to take your legs straight out like this, turn them out first, see how far you can go. For me, I get more tension again on my right side. Okay, and this is my more
This is what I call my dominant side. This is like if I was going to put a soccer ball on the ground and kick it, it's going to be with my right foot. Now if I go internal rotation like this, same thing. I feel it on my right side. So of course, the fix for this is external rotation for a minute, holding it like that, and then internal rotation like this for at least 1 minute to basically loosen these muscles up. Now there are other ways that you can do a lot of the things I just told you about here, but those are the ones that I do on a quick, easy basis to make this simple for everybody. So I hope you found that helpful. If you did, give us a like. Also, subscribe to our YouTube channel, and also turn on the notification bell so that you can get more info from us, because we're doing this every single week, giving you some great content, and we also appreciate comments down below. So I'm Dr. Mark LeMay. Thanks for watching. Want to test it?
Yep, go
ahead.
ahead and test. So, hi, I'm Dr. Mark LeMay.
Hi, I'm Michelle LeMay, and welcome to the Wellness Connection.
Hi, I'm Michelle LeMay.
Hi, I'm Michelle LeMay, and welcome to the Wellness Connection. I'm going to be baking liver pate today.